Hi, everyone. I'm Dr. Klint Peebles, and I'm honored to be the chair of an incredible event coming up in a few short months, a first of its kind intensive conference on lesbian, gay, bisexual, transgender, queer, sexual gender minority, or LGBTQ SGM, health and dermatology. Over the last many years, we've seen a marked focus on issues related to diversity, equity, and inclusion, and more broadly on the mitigation of health disparities. Sexual and gender minority people, or SGM, have rightly captured the attention of the medical community, but dermatologists currently have no clearly standardized way of getting the information they need to provide excellent, evidence-based, and unbiased care to this population. A recent survey, in fact, showed that almost half of dermatology residency programs had 0 curricular hours dedicated to SGM content. And with the number of people identifying as SGM in the United States increasing every year, up to almost 6% of the population identifying as LGBT by current estimates, there has never been a better time to start learning and to get involved, and that is exactly what we're here to do. Our program will cover the full gamut of sexual and gender minority health and dermatology. First, we'll start with a core introduction to SGM health, including approaches to structural competency and cultural humility, essential terminology, and the socio-political backdrop of why these issues are so important and why and how LGBTQ health disparities emerge. We'll also hear from expert leaders in psychiatry who will provide a framework for how mental health and resilience intersect with the care that we provide for LGBTQ people as dermatologists. And next, we'll take a deep dive into medical dermatology, and we'll hear from experts in the gynecology space, among others, who will take us through gender-affirming hormone therapy and its complications, as well as how to manage contraception in this population. You'll hear about the latest expert guidance on acne treatment, as well as approach to hair loss in gender-diverse individuals and how to conduct sensitive examinations, all while preserving a safe and validating space for the most important person in the room, the patient. We'll be lucky to hear from some of the leading experts in minimally invasive dermatologic procedures for gender affirmation. You'll hear about facial modification, neurotoxin, soft tissue augmentation, and hair removal in the setting of gender affirmation, and best practices for these procedures, along with considerations on billing and coding, as well as insurance coverage. And you'll also hear about a multidisciplinary approach to care as our expert faculty share how they coordinate care with primary gender surgeons. So whether you're a newcomer to these topics with questions about terminology, basic concepts, and how to create a safe space for SGM patients in your clinic, or you're a seasoned expert looking for new perspectives on holistic and intersectional care for this population, or the latest on providing quality and evidence-based gender-affirming dermatologic care to gender-diverse individuals, this conference will have something for everyone. Our faculty will be coming from across the country and from a variety of practice environments, each offering unique and expert insight on critically important topics. And our goal is that this conference will inspire you to not only think more critically about issues of sex and gender in medicine, but also to empower you to serve an important, underserved, and growing demographic that is greatly in need of the care that only we as dermatologists can provide. And we can't wait to see everyone there.